All right. Hello, everybody. Welcome to the Georgian Fahey Center for Healthcare Innovations 2023-24 Patient Engagement Lunchtime Learning Series. This series is accredited by the Royal College of Physicians and Surgeons of Canada as a group learning activity, and it may also be eligible towards credits requirements of other professional bodies, such as the College of Pharmacists of Manitoba and the College of Registered Nurses. Please note that for the lecture portion of this session, participants will be muted and video turned off. We will re-enable this feature during the question period when the recording is ended. The chat will also be restricted to sending messages to myself as the host or co-host only. To use the chat box, click the chat button at the top of your screen and enter your text where it says type message here. If you have any trouble with Zoom, please feel free to reach out directly to me at any time. We have auto transcription enabled, so you should see closed captioning for the session. If you want to toggle this on or off at any time, you can do so using the caption button at the bottom of the Zoom screen. For today's session, we will learn about cultural components of safer ways of engagement in health research. For this session, we welcome Ogai Sherzoy, Thomas Bidri, and Hani Atan Al-Abidi, whom he was unfortunately not able to join us today, so we'll just have Ogai and Thomas with us. Ogai is a knowledge broker here at the Center for Healthcare Innovation. In this role, she works closely with folks with lived and living experiences and community members, clinicians, as well as health researchers. She provides supports in the areas of trauma-informed and cross-cultural facilitation, development of patient and public engagement strategies, and participatory approaches. Ogai has over 17 years of experience working in the social services field across diverse communities and settings. She is a big proponent of using social justice, anti-oppressive, intersectional, and a health equity lens within her work. Ogai deeply values the strengths and resiliency of individuals and communities and the importance of building trust through relationships. Thomas Bidri is a proud Indigenous man, a proud father of three, which are two young men and a young woman, and a mishum to two boys. He is a graduate of the Center for Indigenous Environmental Resources with a certificate in environmental protection, focused on environmental-related issues concerning Indigenous peoples and communities. Thomas is currently employed with the province of Manitoba's Department of Sustainable Development as an Engagement and Reconciliation Community Coordinator. His goal is collaboration between environment and healthcare fields by acting as a bridge, a facilitator in these fields, and with Indigenous people in order to assist in creating a way for healthy people and communities. Welcome, Ogai and Thomas, and please go ahead when you're ready.
Thanks, Victoria. Hi, everyone. Welcome. We truly appreciate you joining us today. Thank you for your gift of time. I would like to start the session by acknowledging that we are gathered on the ancestral and current-day lands and waters of the Anishinaabe, Cree, Ojibwe Cree, Dakota, and Dene peoples, and on the national homeland of the Red River Métis. In northern Manitoba, we acknowledge the ancestral lands of the Inuit and gratefully acknowledge that our water is sourced from Shoal Lake 40 First Nation. We respect the treaties that were made on these lands, we acknowledge the harms and mistakes of the past and present, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. I'm holding myself accountable to take actions by continuing on my path of learning and expanding my knowledge around Indigenous cultures, the history and present-day colonialism, ways to decolonize in my personal and professional life, and actively challenge my position as a first-generation immigrant settler and my beliefs through practicing self-awareness and reflexivity. Also, it's important that I pass my knowledge down to my kids to ensure they too are creating inclusive and safer spaces. On June 21st, for National Indigenous Peoples Day, we recognize and celebrate the history, heritage, resilience, and diversity of First Nations, Inuit, Métis individuals, and communities across Canada. Today's introductory session is to provide you a general definition of cultural awareness, cultural sensitivity, cultural competence, and cultural humility. and how these concepts are closely connected to cultural safety. Through the literature, although not universally agreed upon, many scholars have expressed how these concepts work together, build on each other, and seen as on a continuum or steps towards cultural safety. However, oftentimes these concepts are used interchangeably when discussing culture and cultural safer practices in health research. So today we're using steps to illustrate how these concepts lead to cultural safety. And as we go through these steps, I'm hoping you're able to locate yourself on which steps you are in and how can you take a step forward towards cultural safety. And I also want to invite you to think about this learning as a process that requires continuous training and determination on your part, and our journeys will look different from one another. But the end goals are the same, to create a more equitable healthcare and health research for all. And I also want to mention that this session, Indigenous is used as a collective term, describing First Peoples of this land, First Nations, Inuit, and Métis. And within these groups, there are diversity of languages, teachings, and traditions. Also, immigrant, refugee, new Canadians, newcomers are terms used, but please be mindful that there are folks from different countries, cultures, languages, and experiences. And so culture is complex, and there is no single best definition of culture. In general, it's best understood as systems of learned and shared beliefs, practices, languages, norms, values, and symbols that groups use to identify themselves and provide a framework within which to live and work. And so we're hoping to turn to all of you. And with this definition in mind, just taking a moment for all of us to reflect on what does cultural safety mean to us. So as you will see, we have a Mentimeter to create a word cloud. So you can either use the code by going to menti.com and entering the code on the slide or in the chat box, and then putting in your answer. Okay, so we have not making assumptions. Celebrating differences, absolutely. Respect, learning, absolutely. Are there others who would like to share some of their thoughts around what cultural safety means to you? Okay, so there are some more. Anti-racism, I see. Not judgments, freedom of speech, anti-oppression, queer-friendly, diversity, trust, absolutely. Freedom to express oneself, welcoming. This is great. Acceptance, care, consequences for hate. Know how I impact others. Humility, inclusivity, acceptance, socially accountable, social justice. This is great. And as you will see, everything that you have written will come through in this presentation and conversation. And so we will keep the word bubble. We'll save everyone's answers. And then after the presentation, we will be sharing the PowerPoint. So you will have all the different answers that will come out. Thank you everyone so much for sharing. What a great group. Okay, so we're going to look at the first step, which is cultural awareness. Cultural awareness is the first step towards cultural safety. It is the initial awareness and acknowledgement of cultural differences and observing those differences. So in other words, awareness about differences between two cultures. The limitations of cultural awareness is that it focuses on the other and the other culture. Cultural awareness does not consider political or socioeconomic influences on cultural differences, nor does it require an individual to reflect on one's own culture or privileges or positions, and it impacts on others and other cultural groups. And cultural sensitivity is the second step, which builds on cultural awareness, the acknowledgement of the differences between cultures, with the addition of the requirement of cultural acceptance, respect and understanding, and self-exploration. Cultural sensitivity was first developed in the late 80s by Milton Bennett as a way to recognize the need to respect cultural differences. Cultural sensitivity involves exhibiting behaviors that are considered polite or respectful by the other person of the other culture. And similar to cultural awareness, cultural sensitivity focuses on the other and the other culture. However, with cultural sensitivity, we're stepping forward as we are now starting our journey towards self-exploration, own life experiences and realities, and the impacts it may have on the others. So really, it's about seeing ourselves and ourselves in relation to others. And cultural competency is viewed as the third step towards cultural safety as it builds on cultural awareness and cultural sensitivity. Terry Cross and colleagues were the first to introduce the term cultural competency in the 80s as a recognized approach to improving health provisions and aiming to reduce health disparities for Indigenous peoples, as well as culturally diverse folks. However, from the literature, there are varying definitions of cultural competency throughout the decades. For example, in the 90s, it was individually focused framework that required folks to continually learn to gain a deeper understanding of another's culture. So for example, obtaining skills, knowledge, attitudes to work with folks in a more effective and respectful ways. The framework included ways professionals and researchers' ability to assess, respect and value, attitude and beliefs of persons and communities from another culture, and respond appropriately in planning, implementing, evaluating a plan that incorporates health-related beliefs and cultural values, knowledge of health and illness, and treatment preventions and interventions from their cultural perspective. And cultural competency was critiqued for being limited as it focused on acquiring knowledge without, again, one's own positionality, self-reflection and reflexivity, as well as policies and institutional influences and its impacts. So in the 2000, there was a shift in government policies, and cultural competency scholars began to express culture competency in terms of individual and organizational, institutional level interventions. And it described it as a broader system level. So it encourages us to delve deeper into organizational practices. So in other words, it's organization to individual relationships and not individual to individual per se. And I'm just gonna move this over. And so cultural humility is the fourth step and builds on the previous three steps. The term cultural humility was coined by Jan Murray Garcia and Melanie Trevelyan. Cultural humility values and encourages lifelong learning and self-critical reflection, along with respectful and inquisitive approach, whereby practitioners and researchers are expected to seek knowledge from folks they're engaging with regarding their culture and structural influences, rather than assuming, undertaking, or being the expert about a culture outside of their own. Cultural humility is about readdressing power imbalance dynamics. So, for example, when conducting research or engaging folks as partners in your research or advocacy partnership with communities, it is important that we examine the power dynamics, our own unearned privileges, and develop mutually beneficial partnerships. And practicing and incorporating cultural humility enables us to work towards cultural safety. As mentioned, it is a process of self-reflection to understand personal and systemic biases and privileges in order to develop and maintain respectful processes and relationships based on mutual trust. And cultural humility involves humbly acknowledging oneself as a learner when it comes to understanding another's experience and dismantling power imbalances. And key attributions of cultural humility, again, it's personal lifelong commitment to self-evaluation and self-critique, whereby individuals not only learn about another's culture, but one starts with an examination of their own beliefs, cultural identities. It's really about empathy and compassion. It's the recognition of power dynamics and imbalances, a desire to fix those power imbalances and to develop partnership with people and groups who advocate for others. And like we've seen in the word bubble, institutional accountability. So all the previous steps leads us to cultural safety. Racism, discrimination, stigma are well alive and threaded throughout our systems and communities. And as a result, it contributes to a lack of culturally safer supports and services and significant inequalities in our experience to determinants of health, access to healthcare, and culturally safer research. And therefore, cultural safety is believed to be more fitting for the purpose of achieving health equity. Cultural safety is a term that was first coined by the Maori nursing student Hinirgani Mahi in New Zealand in the 80s as a way to address the Maori health inequities. And the term cultural safety was commemorated by Hirepti Ramdan's PhD thesis, which further shed light to the concept as a framework. Cultural safety is now embedded more broadly and recognized internationally. And cultural safety is an evolving concept, which in and itself is important to recognize that it allows flexibility for folks and communities across the globe, the ability to identify what cultural safety means to them within their own historical and current context and living experiences. It is very important to recognize that cultural safety is both most rigorous and extensive within Indigenous context. Indigenous scholars, knowledge keepers, community leaders have done tremendous work in this area of cultural safety and have paved the way. It is all of our responsibility in our personal and professional life to take these teachings and to humbly continue on our journey of unlearning, learning, advocating, and taking actions towards health equity and social justice. And what sets cultural safety apart from the previous step is that it's working towards safety. We're meaning ourselves, organizations, and systems. And we have to be prepared to critique unearned power structures and be prepared to challenge our own culture and cultural systems that might be perpetuating oppression and furthering health inequities rather than prioritizing becoming an expert in the culture of others. So in other words, to create and flourish meaningful and equitable change, systems and research need to be reflective of Indigenous peoples and culturally diverse people and communities. And complementary to cultural safety is Stephanie Nixon's work that supports the notion of challenging unearned privileges and systems of power. It's called the Coin Model of Privilege and Critical Allyship. I've included the coin model as it's a tool that translates foundational ideas of anti-oppression. And the metaphor of the coin is used to explain historic systems of inequality. For example, settler colonialism, racism, heterosexism, ableism, which creates unearned advantages, i.e. privilege, to some, and unearned disadvantages, i.e. oppression, to others. The coin model really helps us to understand and see the intersectional approach to describe how multiple systems, or the metaphor being the coins, interact to create complex advantages and disadvantages that creates inequalities. And Nixon expresses how we only focus on the bottom of the coin. And the people at the bottom of the coin are the experts that already know how these systems of oppression work. Yet we continue to focus on the bottom of the coin. We have so many titles for people at the bottom of the coin, for example, marginalized, equity deserving, oppressed, and the list goes on. Yet we seldom acknowledge systems creating these disadvantages, and we don't acknowledge the unearned privilege at the top of the coin. If we did, we could then start to create solutions. The point of the coin model is one of the ways systems of inequality ensures status quo is by people in positions of privilege remaining ambivalent of their own complicity in reproducing them. So the coin model supports people to become less ambivalent about their positions of privilege, which in turn opens new possibilities for actions to interrupt, resist, and dismantle harmful structures. And I want to quickly highlight that Nixon does acknowledge that the coin as a metaphor that translates ideas of privilege and anti-oppression is new. But the ideas that are being translated through this metaphor are not new. These understandings of how power operates in society come from Black and Indigenous thinkers. As we see with cultural safety, these ideas were being brought to light 40 years ago, if not even longer. And I highly suggest taking a look at her work, as it creates a great learning opportunity to expand our knowledge, to do better, and to work towards health equity. And really, the goals of cultural safety really is for all people to feel respected, safe when they interact with healthcare system and engage in health research. And culturally safe healthcare services and research are to be free of racism and discrimination. And people are supported to draw on their strengths from their identity, culture, and community. I am conscientious of time, so I will quickly go over the components of cultural safety. I'm just sharing the basics, but please know each component is comprehensive. My hopes are to introduce you to some of the concepts and that you will continue on your path to more in-depth learning. I also want to mention that in the image, the components surrounding cultural safety are interlinked as they are connected, and you can't have one without the other. For example, we can't create an environment free of racism if we are not reflexive and unaware of our own biases and prejudice, nor can we build relationships. We can't come from a trauma and violence-informed perspective if we are unaware of historical and current context, and so on. So I mentioned reflexivity quite a bit. Reflexivity is the process of examining our own thoughts, attitudes, assumptions, biases, prejudice, feelings, values, motives. But also, most importantly, is where is it stemming from? And how is it impacting and influencing our action in relation to others? For researchers, reflexivity is a great way to continue to examine your positionality. So you become aware of how they're influencing the research process and your engagement with folks with lived-living experiences as partners in your research. Reflexivity is an important part of creating culturally safer spaces, so we are not acting on our stereotypes and biases that could lead to more harm and unsafe spaces for folks. You might hear the PE team at all of our conversations and talks, relationships, relationships, relationships. And I can't speak enough of relationships, because building authentic relationship and partnerships with individuals and communities are the foundation to building trust, respect, and understanding, which is a process that develops over time. Creating relationships helps us to get to know one another, understand and respect different ways of knowing and seeing the world, and people and communities' wisdom and strengths. Continuity and reciprocity are part of relationship building. And therefore, when engaging with folks and communities as partners in your research, building relationship takes place before the start of the research, throughout the research process, and after the research is complete. And Thomas soon will be speaking a little bit more in depth in terms of relationship building. And in anti-racism, like cultural safety is a process and an outcome. It requires an understanding of the structural causes of racism, oppression, discrimination, and stigma, but also anti-racism is a health equity practice, ensuring we are including diverse voices and perspectives and priorities throughout our research so that we all have optimal opportunities to attain best health possible by closing the gap on health disparities. And then when engaging folks and communities, culturally safe environments is free of racism and discrimination and stereotyping. We are incorporating approaches and methods that are culturally relevant, where folks in our communities feel understood and their voices are being respected and listened to. Therefore, creating a welcoming and familiar space where trust can flourish and knowledge can be co-created. Self-determination is the key component of safety. Individuals and communities are the ones to identify what is and isn't culturally safe spaces, and the answer might differ substantially from person to person and community to community. Culturally safe research is crucial for enhancing community ownership of the research process. It has the potential to promote effective and meaningful pathways to self-determination through participation, partnership, protection, ownership, and power sharing. And a great example would be the First Nations principles of ownership, control, access, and possession, more commonly referred to as the OCAP principles. It's about having control over data collection process, own and control how information is used and shared. Trauma and violence informed is part of creating culturally safer spaces for folks and communities. Trauma and violence are connected. Trauma occurs when people or communities experience an overwhelmingly negative events or series of events, including violence. And violence can take many different forms and can be experienced once or many times. An exposure to systemic violence, such as racism, can increase a person's vulnerability to all other forms of violence. And over time, experience of systemic violence can result in historical and intergenerational trauma. So when we are engaging with folks in our communities, though oftentimes it is recommended to provide folks with a list of local, culturally appropriate counseling resources, should individuals require additional supports, more importantly is training and awareness of trauma and violence-informed approaches and putting them in place so folks we are engaging with can have a sense of control, choice, collaboration, connection, and empowerment throughout the research and engagement process. As Dr. Heckenberg states, culturally safe research practices bring a fully informed researcher to the situation that allows individuals and community, no matter their life experiences, to feel safe. Historical and contextual awareness. We all come from places of good intentions, and we're in this field of work to create positive change and make a difference. So when we are engaging with folks in communities, it's important that we do inform ourselves and have a historical and contextual awareness so we don't perpetuate harm and cause pain. It also grounds our work in deepening our understanding of the current political, social, economic situations. Important example would be the historical and present-day colonialism and its rippling effects on Indigenous peoples and communities. Another example of the importance of understanding context and history is when engaging with newcomer folks, refugee or immigrant communities. Having an awareness of their history can help us understand the current context and experiences. And also language plays an important role in culture and history and ways it has oppressed and other people and communities. For example, the word terrorist or terrorism has a long-standing history, which has been used to other and oppress groups of people from different countries who are racialized. So if we aren't aware of this And even if we use those terms in our best of intentions, we are perpetuating negative stereotypes and causing further pain and in turn impacting trust and relationships. Lastly, it's power sharing. So when engaging with folks in our communities, power sharing includes examining the power dynamics and distributing the power within the team and with folks in communities we are engaging with. So we start by recognizing our own power and privilege and changing the dynamics by sharing the power. And you can do this by creating spaces for folks in communities to identify their priorities and share in the decision-making process. Also acknowledging people and communities' strengths and resources as the foundation when designing and implementing research and services, so people and communities can empower themselves. Individuals and communities defining safety for themselves, again, shifts that power as people and communities assess their own experiences and identify their own needs based on their context and experiences. And I will leave you with some reflection questions. Again, these reflection questions will be part of a resource package that we will be sending to everybody as a way to kind of help you get started. So some essential questions that teams can use are you aware of the culture and history of the community you're hoping to work with? Are you aware of the historical experiences and current context of the community, particularly any factors that might have impacted their perspective around research and researchers? And again, just looking back in our history, there have been experiences that has broken trust with community. And so as a researcher or engaging people, having that in mind so that we don't take things personal, but having that deeper understanding to show compassion and understanding so we can flush out and recreate some of that trust. Another question would be, have you considered and have a base understanding of the individual or community specific cultural protocols, values, traditions you intend to engage with? Again, prior to entering a community, it's important to having an advisory group that can advise you on some of these things, building a relationship with an individual that can share some of the protocols so that we are entering people's communities, their lives in the most respectful and dignifying ways. What are some ways cultural differences, power imbalances, and reciprocity can be addressed with humility in order to create safer spaces? And then just some critical reflection questions could be looking at your own social location, your age, gender, immigrant status, employment, ability, religious beliefs, sexual orientation that gives you unearned privilege. Reflecting on your own cultural background and the way it might have shaped your values, your own beliefs, and the ways of your thinking and how you interact with others. And please, practicing self-awareness is so important. It really helps to ground us in thinking our own perspectives and really catching ourselves when we are having biases. We're not perfect. We will make mistakes. But once we start catching ourselves, that's the beginning step of really creating internal change, which then impacts our actions and the way we are with others. And so, yeah, so thank you so much. I do want to leave you with this quote to reflect on by Maya Angelou. Do the best you can until you know better. Then when you know better, do better. And so I would like to invite Thomas to share his knowledge and experiences to provide you with context around culture through real-life examples and expand on your awareness of the importance of creating safer spaces built on mutual respect, shared understanding, and valuing our differences. Thanks so much, everyone.
Bonjour, Anin, Gedage, Magaze, Zatian, and Anu, and Deshnika. My colonial name is Thomas Beaudry. Sorry, I'm in my vehicle making my way to the city, but I think this is an important discussion. miigwech to Olgai. I guess I don't have to say anything. You covered everything for what we need. But everybody who knows me, I do have something always to try to add what is there. When we talk about competency and culture and safety and all the other things, I've seen people put things in here, but now I was thinking about all of that. I looked at freedom, safety, land, language, and equality. What I mean by that is, like, as an Indigenous person, the only two recognized languages of Canada is French and English. How many people come to this country and they're forced to take English teachings or French teachings in order to better themselves and fit into what they call the culture of Canada? Like, what does that really mean? To me, it's like, are they going to just make us all white, anglicize ourselves to have that name that they feel comfortable pronouncing? And what I mean by that is, like, think about it, Abenuchi Mi'kmaq. Everybody, which is formerly Bishop Grandin. People are saying, well, how are we going to say that name? How are we going to say that name? But if you can say Bufflin, which was a hockey player for the Winnipeg Jets, I'm sure you could learn how to pronounce the names that we are sharing with you. And it makes it safe for us to be able to see our names as an Indigenous person. Somebody told me creating this safety isn't just about what's best for you. It's got to be best for how we are going to relate to one another, how we are going to look at each other as human beings. What I mean by that is that we're all equal. We're all equal as human beings. You earn your title as a researcher, you earn your title as a doctor, but it doesn't mean that you are better or below anybody. It means you're still an equal human being with knowledge to be able to help us go forward together. So when I seen the coin analogy by Olga, I said, from my perspective, let's stand that coin on end. Look at it as a circle. And when you look at it as a circle, I look at all of that is that we all, and from my perspective as an Indigenous person, we look at everybody in that circle is equal. So if you look to your left, look to your right, we are all humans there. It's balanced. So we don't have to worry then about the inequalities where there is sitting there to be safe, where you're sitting there to knowing that we are going to be heard or not heard. One of the things within our culture, silence doesn't mean that we don't know. We are being respectful of what is being shared with us. So we listen. It's going to take time for us to respond. We have to think about how those words are being shared with us. If it's in English, we got to think of in our language first, then what that means. What does that word mean to us? So that's where I was looking at equality. When you try to develop a relationship, how do you do it? That's a hard question to really do, to self-reflect. Well, how do I develop a relationship? Is it making myself feel comfortable? When I do little presentations, I always say it's time to be comfortable being uncomfortable in our discussions in order to go forward together. From my perspective, as an Indigenous person, if it's an Indigenous issue, we step forward and we talk about the Indigenous issues, but we can look to our left and right and look to see who's there with us, and that's you. Then we wait for you to come catch up. When it's a non-Indigenous issue, you speak about it, or whoever was with us. But you could look to the left and look to the right, we're there with you. It doesn't mean that that we are going to always have the answer, but we can help you find the answer. Sometimes looking for answers could be like this, could be like this, or it could be completely right there in front of you. So when you're looking at this cultural side of things, what does culture really mean? Culture to me means to be able to do, live, walk, talk, and feel safe doing it without being looked down upon without being judged as an Indigenous person. And think about this, how Canada is the only nation in the world that has a piece of legislation to tell Indian people who they are, me. And it's the only piece of legislation in the world that tells us how to live and where to live. So is that really freedom? When we come into the hospitals, it becomes a jurisdictional issue. Who covers our medical expenses? Is it the Fed, the Crown, the King now? Or is it going to be the province that covers that? That's why we have Jordan's principles. That's why we have the lady from Quebec now. Things are trying to change things. Because we are still looked at as a piece of legislation and governed outside. So when we ask for culture safety, culture competency, I guess is the way to look at it, we want balance. We want equality. We want to be equal to what everybody else is getting. We're not asking for more. And I know that a lot of times I hear the word stakeholder. As an Indigenous person, we're not a stakeholder. We're a rights holder. We have these rights also. Like when you hear, oh, go back to where you belong. What does that really mean? I guess like one person I said to is that, well, when you wake up in the morning, I'll have my teepee on your front lawn. Because we don't have another land to go to. We can't cross the waters. We can't go back home. This is our home. So when we try to look at that culture of safety, it's a matter of how are we going to live together? What are we going to do together? How are we going to listen to one another? We have two of these, one of these. We have our heart and we have our mind. But we got to use those all together. Yes, some people might be blind, but then they have their hearing. If we stay here, we're only thinking with our mind. We're not worried about the empathy that needs to go with it. But if we're here, then our mind, it might not allow us to make the right choices. So we got to find that balance of how we're going to work to each other in regards to our culture. So when you say, how do we make a relationship? I thought about that too. This is as part of our SPORE unit that I've been on for a number of years. Everybody thought, I guess maybe the way they were trying to develop that we were going to develop a terms of reference. But we went, us as patient caregivers, this is something that's going to guide us. It's not called guiding principle. Do you think it happened in one meeting? Everybody thought it was going to be done in one meeting and we could continue on. No, it took time. It took time to build that relationship of trust and understanding, respect. So it took us at least 3 or 4 meetings before we had our guiding principle. What I found from that is that we took the time to build that relationship. It wasn't rushed. We developed a safe way of talking to one another. We heard each other. We took turns. And the biggest thing was we didn't have anything pre-written down. Everything was developed by us, with us, in order to work together and that we could share. And when we bring new people into our circle, they add to it. It isn't a stagnant piece of guiding principles. It's added to because they have a different way of maybe that can help us go forward together. So culture, what does it really mean? I have a different culture than everybody else. I have a different culture than the Cree. I have a different culture than the Innu, the Inuit. Our culture isn't all the same. Urban versus rural Indigenous people, we have a different culture. So when we talk to one another, we try to understand. We might not speak the same languages. We might not have the same understanding, but as we try to build a relationship. When you build a relationship, you become family. And when you become family, you're allowed to disagree. You're allowed to not always agree to one another, but you do it with respect. But you could come back and do things together. Wonder if this will stay up here so I can show. It's like I always say when I talk, we work on a zipper. We build our relationships with the small things, starting getting them together, build them stronger. And as we get stronger, that zipper is hard to take apart. But here's the difficult part of how we work together. Eventually we can do that. And once we do that, what do we create? We create a circle. And that circle will become strong. Now we're all equal. We're all making that decision. And we can go back and forth and not always agree because we develop slowly these relationships. So we finally get into this. Somebody says, oh, you can make it into a heart. I remember somebody telling me that, which is true. But we also got to include our mind in that circle. And remember, in that middle of that circle is you. And everything around you is there for you. Our culture is also in the middle, and everything around that is for all of us. All of us as human beings. Remember I said at the beginning, we're all human beings within that circle. So everything we do is going to impact how we relate to one another. So remember, don't be impatient. When you try to build a relationship, it's going to take time. It's going to take time to build trust, especially from an Indigenous perspective. And it's going to take time to build that respect. Respect is while trying to work together as we go forward on the hard issues. So it's also reciprocated. Like I said, reciprocation is such an important part of our culture. When we take something, we got to give something back, especially when it's in the nature. When we take something, we offer something for it because it's giving us something. Medicine, food, the use of land, the use of the air. We do that in a good way. So culture is very diverse. As I've been sharing with our equity, diversity, and group, we're not a melting pot. I like to look at ourselves as a salad bowl. What I mean by that, if you look at a salad, look at all the things that go into a salad. But each one of them are nicely bright colors. But now you mix them all together, and it even looks more scrumptious to eat. Because why? They all complement each other. They all help each other. They all have their unique taste. So we're not a melting pot, but we're a salad bowl of how we get along together. And our different cultures is going to make that salad bowl even more. We keep adding to it. We add a little bit of this, a little bit of that. And we don't try to take anything out. If we don't want it, we just put it aside. We don't disrespect it. We put it aside. But it's still there for us to see. And maybe we get brave enough, well, let me try that hot pepper. There we go. And that's okay. But everybody has a way to be coming together. So for me, let's look at ourselves within a circle. Look at ourselves as equal. And take time to talk to one another. Take time to ask of uncertainty. Hello? Am I still there? Am I gone?
Hi, Thomas. I can hear you. We have about
Okay.
couple of minutes for questions. Are you?
I can wrap it up. So remember, I'll wrap it up right now. Is that look at ourselves with our unique, different cultures, and keep your cultures strong to yourself. Then look at us as human beings, and then we can start working together and living together in peace and love. So, miigwech for allowing me to share.
Thank you so much, Thomas. We'd like to open it up to all of you. If you have questions, comments, please share.
Sure, thank you all. I'll just give us a minute to give you back your unmuting abilities, and we'll stop